The question is that this House do now adjourn, and I call Chris MacDonald, treatment of Duchenne muscular dystrophy. Chris MacDonald.
Thank you, Madam Deputy Speaker, and that was perfectly articulated. And I'd also like to thank the Minister for what I think is possibly a triple shift at the dispatch box today, so thank you for that. Now, a few months ago, I met three really great young lads, Benjamin, Eli and Jack. We had a really great conversation. They had me sort of laughing and joking along for a very long time. I know I slightly disappointed Eli when I first opened my mouth, because listening to me, he recognised where I was from and he asked if I could introduce him to Sam Fender. Now, the North East is quite small, but I don't know everyone, and I could see the disappointment on his face. But one of the things that we talked about was what they want to do in the future. Perhaps Eli is considering being a musician. Jack said he would like to do something in public speaking, who knows, even be a politician. It was really great to see that level of ambition for them, but it was, for me, tinged with a moment of sadness, because I knew that they were unlikely to realise that ambition, because Benjamin, Jack and Eli are unlikely to see their 30th birthday. Benjamin, Jack and Eli all have Duchenne's muscular dystrophy. It's a disease that only affects boys. Around 100 baby boys are born with it every year, and the diagnosis is normally realised at around the age of 3 or 4, and it's at that moment that parents find out that their son has a life-limiting condition that can't be treated, that they'll probably need a wheelchair by the age of 12, and that they will need a ventilator probably by the age of 20. There's no cure for Duchenne's muscular dystrophy, but there is hope now with a new drug called Jvenistat. Jvenistat was developed by an Italian company, Italfarmaco, and it's an example of the brilliance of our UK life sciences sector that Italfarmaco decided to develop that drug here in the UK. And because it's been trialled here, they've given a unique option to the National Health Service to access Jvenistat on an early access programme entirely free of charge. So the NHS can offer this drug to boys in the UK completely free of charge. And that early access programme has been available since November last year. Now, you might think that that opportunity would be seized quickly by the NHS, but sadly it hasn't been. Many families have had their hopes raised only to have been dashed to find that they can't access the treatment. Patients, families and charities are now calling for urgent access to Jvenistat, as are many members of this House. My constituent Tracy is one of the many who've been fighting for their children's right to live and for the treatment that's been proven to slow down the progression of Duchenne's. Her son Tom is 14 years old, and she tells me that he is deteriorating. Now, Jvenistat has market authorisation for all boys with Duchenne's over the age of 6. It's been proven to slow the progression of Duchenne's in clinical trials. It's not a cure. The families realise it's not a cure, but it could potentially help boys and young men to keep walking and use their muscles for longer. I'd be very happy to give way. Yeah.
Can I thank my honourable friend for giving way? Like him, I have a constituent in my own area called Jamie Tierney, who sadly suffers with Duchenne muscular dystrophy as well. Recently, he has been able to begin getting treatment, as have other patients in Scotland, but it took a lot of work and in some cases intervention by lawyers to try and get that. Does he agree with me of what Jamie's family tell me, that time is muscle, and the sooner we make sure Jvenistat is available across the UK, in all parts of the UK, and as quickly as possible, the better for those people?
Yeah, I do agree. It's a very timely intervention, and in fact the slogan of Duchenne's UK is time is muscle. It's absolutely right. Every day, every week makes a difference to these boys. Absolutely. Yeah.
Madam Deputy Speaker, first of all, can I congratulate the Honourable Member for Stockton North for bringing this forward. He and I spoke about it the other day. I have some constituents, I have to say that it's been a brave few years that they've had the Duchenne muscular dystrophy, but the problem for them is, of course, that the opportunity of this drugs has never been there for them. But it needs to be. Up until now, in Northern Ireland, Duchenne muscular treatment includes corticosteroids, physical therapy, other supportive therapies, and access to newer treatments like Vamorolone or Jvenistat are being worked on. We in Northern Ireland haven't access to them yet either, and it seems to be that it's almost like a postcode lottery. But does the Honourable Gentleman agree that we've got a life-saving, life-changing opportunity to have drugs that give those young boys an opportunity which they would never have without it? And today, with great respect, the Minister's here, government needs to move and make sure that we can all get it.
Thank you, Member for Strangford, for that intervention. I'm very pleased that he's intervened, and I think this idea of a postcode lottery is exactly right. I noted when I looked at the figures that Currently, the Belfast Health and Social Care Trust is not offering this drug to lads in Northern Ireland because they're claiming it will cost £309,000 for 13 patients. That's an order of magnitude out with the rest of the country. So I think I'd be grateful if the Minister would look very carefully at the situation in Northern Ireland. I absolutely will, yes.
I thank him for securing this debate, and I've been engaging with Oxford University Health Trusts in Oxfordshire who aren't providing Jvenistat yet to boys in Oxfordshire, and their own business case suggests it would cost less than £2,000 per boy, £66,000 in total for the 35 boys. Clearly, this is a sum of money that we should be able to afford as a country. And does he agree with me that a institution that wants to be world-leading, a world-leading hospital, should be providing it? And would he further agree with me that this is exactly the kind of thing we need government intervention on so that these boys can get treatment as soon as possible?
I recognise the figures from the Oxford University Hospitals NHS Foundation Trust. They're quoting around £200,000 per lad treated, which I understand is very similar to other areas of the country as well. And I see that as quite a small amount of money for the 35 lives that could be saved. So despite, as we've heard, despite Jvenistat being available for more than 7 months, it's been really a very inconsistent approach across the UK. And actually a very small number of ambulant people living with DMD have so far received the treatment, and no non-ambulant boys have treated it yet. Yes, I will give way, of course, yes.
Thank you, and I also thank my humble friend for bringing this important debate. I met with a family in my constituency whose son is suffering with Duchenne. He is at that key stage right now where he's still got his mobility, but he's starting to lose it. And would he agree with me that, as the campaign says, time is muscle, and if we act now, we can prevent further deterioration of their mobility?
Yes, you're absolutely right about that. Time is muscle, as you say. And sadly, because the drug is currently only available in the areas in which it's available to lads who are ambulant, it means during this waiting time, there are some lads out there who would have qualified who now no longer qualify for it. That's frankly heartbreaking, I think. But we also need to think that the use of one's legs is not the only thing that people are concerned about. Of course, we need to use our arms to be able to dress ourselves, to feed ourselves, to brush our teeth. And Duchenne and Jvenistat could equally help with that. But I think it's very disheartening that whilst coping with all of this, families, parents, carers and so on are having to fight for access for the drug on a trust-by-trust basis. They've done that with the support of all of the members who are in the chamber tonight. I'm very, very grateful that the members have turned up, because I know that families are watching. But I also wanted to mention some members who approached me who would have loved to be here but can't due to other commitments in the House at the moment. So the member for Newcastle upon Tyne East and Wallsend, who campaigned on this subject for many years and chaired the APPG. The member for Basingstoke, whose constituent Henry, who has the disease, visited Parliament on Monday, and we're so pleased to see on the Annunciator that we were having this debate. The members for Bury North and Bury South have worked together to ensure that Manchester's NHS Foundation Trust now does provide the drug to their constituents. And the member for Stevenage, whose constituent William from Codicourt is living with Duchenne's. The member for Chester South and Edinburgh has been supporting Mr and Mrs Binns, whose son Jack has Duchenne's. They don't yet have access to Jvenistat. They're trying to get that. And I've also had representation from the members from Beckenham and Penge, Westmoreland and Lonsdale, Altrincham and Sale West. So you can see that there is broad support across all parties in the House, people working with their constituents to try and secure this drug that is free of charge to the NHS. And whilst, as we've heard, it's very patchy across England, there is some central coordination in Scotland, but no lad in Northern Ireland can access this treatment. Now,
on that point, would the Honourable Member give way?
I will give way.
Thank you to the Honourable Member for Stockton North for bringing this important debate. I think quality of life with this drug is very important to acknowledge, but we also have to acknowledge for many people with Duchenne's, they're living with 24/7 care needs, including my constituent Dylan Phillips, who lives at the excellent care home in Glenbervie. Would the Honourable Member support that those living with Duchenne's in Scotland should be protected as they would be in England under continuing healthcare schemes, rather than having to bear the cost of their social care and living on only £35.90 a week of universal credit and adult disability payment because they don't qualify for continuing healthcare in Scotland?
Yes, thank you for that intervention. I think the important thing for us to consider here, with only 1,100 lads and young men in the country living with this disease, only 500 boys who are eligible for the treatment, then we could at least expect some consistency in an approach across the whole of the United Kingdom.
on that point?
Absolutely will, yes.
Just to build on that point, I recently met with parents of a young man in his 20s who, first of all, absolutely reinforced the need to get Jvenistat sort of funded properly across the country. But I was also struck by the fact that there were two parents, teachers, had another child as well, and their lives were deeply affected by having to support their son. So would he agree with me in making sort of a plea to the Minister to make sure that they can be reassured that adult social care services are going to continue to support people like my constituents in their ongoing, so that their lives can be enriched as well?
Yes, thank you for that intervention. I think it's really important that we remember the parents, the families, the carers, the big support network around these boys, and it just seems to be such a small thing that we need to do from the point of view of the NHS. But there are some very good examples as well. Leicester Royal Infirmary has led the way as being the first hospital to dose a patient. But some large specialist children's hospitals in many areas, as we've heard, have been very slow to commit, and only a few have actually started dosing patients. But some are still working to make Jvenistat available. However, the barriers that we hear about are a lack of capacity, resource constraints. Clinics say that they need small amounts of additional consultant time, pharmacy support and extra blood tests. But really, in the context of the number of blood tests that are carried out in the NHS on a daily basis, this is really, really quite small. Now, some trusts still insist on telling families that they can't deliver the treatment because of this, but I would really like to hear from the Minister, given that some trusts can and some trusts can't do it, what we might do to even this out across the whole of the country. Now, one concern that I know some trusts have expressed is what if they start patients on Jvenistat, but then it's subsequently found that it isn't approved by NICE at their upcoming meeting in July, and that they would have to withdraw the treatment. Well, they wouldn't need to withdraw the treatment because Italfarmaco, the previously mentioned pharmacy company, has made it clear that in the event that there is a negative decision from NICE, they will continue to provide Jvenistat for those already enrolled on the early access programme for as long as it's deemed to be clinically beneficial to the patient. Continuity of supply letters have been signed between hospitals taking part in the early access programme and the company to ensure that this is in line with NHS England guidance. There are two reasons to accelerate this rollout now before NICE's decision in July. One is because every day and every week makes a difference to these young lads, and the other thing is because every lad who gets on that programme before July will be guaranteed this for the rest of their lives until if it's not approved by NICE. Now look, when I met Benjamin, Jack and Eli, I'd already disappointed Eli by not being able to introduce him to Sam Fender, so I thought I'd try and redeem myself. And I said to them, look, I've come to see you, but clearly, you know, when you came to Parliament, you didn't want to meet the member for Stockton North. Who is the person you'd most like to meet? And they all said they'd like to meet the Secretary of State for Health. Not primarily because he could help them with their disease, but apparently they like him and he's a very popular member of Parliament. So I said, well, I'll see if I can sort that out. So I did manage to sort that out, and he very, very generously gave a lot of his time. I think his private office thought that he'd vanished off the face of the earth because he had a great time chatting to Benjamin, Jack and Eli. And I know that his intervention, it really cheered them up, but it also gave them hope. It gave them hope for their futures. And I'd like to sincerely thank the Secretary of State for Health for the generosity of his time on that day and the difference that he made to those boys. So, my request of the Minister, essentially, in the short term, what these families need for hospitals with specialist neuromuscular services across the whole of the United Kingdom, in England, Wales, Scotland and Northern Ireland, to implement the early access programme swiftly and for it to be rolled out to non-ambulant patients as well. The free availability of the drug from the manufacturer means the cost alone is not the barrier here. The barrier is bureaucracy. My simple ask from my right honourable friend is to act with the urgency needed to roll out the medicine across the country as quickly as possible. Every day, every week matters. The lads with Duchenne's do not have the time to wait.
Yeah. Minister Karen Smith.
Thank you, Madam Deputy Speaker, and it is a real pleasure to respond to this debate, which is a moving debate, and I know many people with Duchenne muscular dystrophy and their families will be wanting to tune in to this debate. And can I offer my thanks to members who have contributed to the debate in different ways. The Honourable Member for Stockton North in securing this debate and advocating so powerfully for these families, and particularly I think really brought to life the lives of Benjamin, Jack and Eli in particular, and I commend him for that work in doing so. So first of all, I'd like to acknowledge the profound impact that this disease has on those living with it and their families, as we've heard today, and the urgent need for new and effective treatments for this debilitating disease. And as has been said, my right honourable friend, the Secretary of State for Health and Social Care, was able to hear firsthand from people affected by this condition when he had the opportunity to attend the event by the Duchenne UK earlier this year, and where he met many young patients and listened to the challenges that they face. And as we all know, when we meet families and individuals from our constituents, that leaves a long and lasting effect on you, and it's important that we always continue to do that. Timely and equitable access to innovative medicines for the treatment of rare diseases such as this and other diseases raised today is of the utmost importance. The National Institute for Health and Care Excellence, or NICE, is the independent body responsible for accessing whether new licensed medicines can be recommended for routine use for the NHS based on a thorough assessment of their clinical and cost effectiveness. Through this process, many thousands of patients, including patients with rare diseases, have been able to benefit from effective new treatments at prices that represent value to the NHS. Now, NICE has been able to recommend 2 medicines for treatment here. Ardularen, recommended in 2023, and most recently Varmuralen, excuse my pronunciations, I do always struggle, which was recommended in January this year and is now available on the NHS to around 1,700 eligible patients, in line with NICE's recommendations. As my honourable friend will be aware and has said, NICE is currently appraising Jvenistat, with the first NICE committee meeting scheduled for July this year. And if recommended, the NHS in England will be legally required to fund the medicine. Now, I'm aware that a small number of patients in the UK have been receiving treatment with this drug through a company-led Early Access Programme, or EAP, established by the pharmaceutical company Etel Pharmaco, as we have heard this evening. Now, Madam Deputy Speaker, it is important to note that participation in these programmes is decided at an individual NHS trust level, and although the cost of the drug is free, as we've heard, to both patients taking part in it and to the NHS Trust must still cover administration costs and provide clinical resources to deliver the early access programme. The NHS England has published guidance on free of charge medicine schemes such as this, providing advice on potential financial, administrative and clinical risks. NHS England cannot, however, centrally direct trusts to participate in company-sponsored early access programmes like this or in any other private activity. To issue any other form of national direction around the participation in EAP, such as this, would both preempt and undermine the role of NICE, whose very purpose is to advise the NHS on whether or not particular treatments should be made routinely available on the NHS. Even in situations where, even in situations where an agreement is made for the company to continue to provide the drug free of charge in the event of a negative decision by NICE, participating trusts remain liable to cover significant costs to deliver the service, including the clinical resources and time to do so outside their funding allocation, and in addition to any subsequent NICE recommended treatments that they would then be mandated to fund.
Donald. And I thank you for a response which I'm listening very carefully to. I do appreciate her point that it would be inappropriate for the Department for Health to direct trusts on what to do. But I think from what we've heard from the trusts is they would like to issue this drug, but they have certain issues or problems. And perhaps it might be simply about the department giving help and support, facilitating the sharing of information between those trusts who've made this work and those trusts who haven't. So more of an encouragement than a direction, perhaps.
I do thank him for that really constructive suggestion, and I think we need to wait for the NICE recommendation and see how that goes in July. And I think, as with this disease and so many others, it is important to share learning, share information, and trust that are providing these services should be encouraged and supported to do so. So I think that is a constructive recommendation which we will work with him on. And I do understand the concerns raised by my friend that non-ambulant patients are not able yet to access Jvenistat. However, it's important to note that the eligibility criteria for participation in the early access programmes have been determined by the pharmaceutical company. NHS trusts who decide to participate in the EAP must only provide treatment in line with these criteria, which state that patients must be ambulant. A clinical trial is currently being carried out by the pharmaceutical company to evaluate the safety and tolerability of the drug in non-ambulant patients and to further explore the efficacy of this drug in this population. I know that that is disappointing to hear for those patients and family affected, that there is no access in the interim period for ambulant patients before a NICE decision or non-ambulant patients prior to clinical trials being concluded. But I want to assure my honourable friend that we have arrangements in place to support rapid access to new medicines. Outside of company-led EAPs, I'm going to finish in the time I've got. I think people want to hear the full response. Outside of government-led EAPs, there are established routes for patients to get access to new innovative medicines prior to them being licensed. And the Early Access to Medicine Schemes, or EAMS, helps to give people in the UK with life-threatening or seriously debilitating conditions early access to new medicines that are not yet licensed, but where there is clear unmet medical need. EAMS is supported by key partners including the MHRA, NICE and NHS England, and is a key part of this government's commitment to accelerate patient access to innovative, life-changing treatments and support the UK's position as a global leader in life sciences. And in fact, since the scheme launched in 2014, over 50 medicines, including for this disease, have benefited from early access through EAMS. The Innovative Medicines Fund has also made available £340 million of ring-fence funding for the NHS to fund early access medicines that NICE has recommended with managed access. Through this process, licensed treatments which demonstrate substantial clinical promise but still have significant uncertainty around their clinical and cost effectiveness can be funded. Further evidence is then collected on the drug for a defined period of time that is considered by NICE in determining whether the drug can be recommended for routine NHS funding. And the Secretary of State has been clear that if Jvenistat is recommended by NICE in draft guidance, NHS England should aim to work with the pharmaceutical company to provide early funding through the Innovative Medicines Fund. This could potentially speed up access by up to 5 months and could see if the treatment being funded as soon as this summer, if recommended. Madam Deputy Speaker, this debate is wider than just access to new medicines. It's important to note that while rare diseases are individually rare, they are collectively common. And 1 in 17 people will be affected by a rare disease condition over their lifetimes. And the UK Rare Disease Framework outlines 4 priorities based on engagement with the rare diseases community. These are helping patients get a final diagnosis faster, increasing awareness of rare diseases amongst healthcare professionals, better coordination of care, and improving access to specialist care, treatment and drugs. In England, we've published a Rare Disease Action Plan annually. These detail the specific steps we are taking to meet the shared priorities of the framework, and I'm pleased to highlight the 2025 England Action Plan, which was published in February this year on Rare Diseases Day. Regarding treatments, one such action is to review the effectiveness of early access schemes like the Early Access to Medicine Scheme, the Innovative Licensing and Access Pathway, and the Innovative Medicines Fund. These are all designed to support innovative treatments being available to patients who need them earlier, and we are specifically considering how well they work in supporting access to treatments for people living with rare diseases like this that we are talking about this evening. NHS England, NICE and MHRA will meet annually to continue to discuss programmes on these schemes. These meetings will include representatives from patient advocacy groups, industry and clinical researchers, and the next of these meetings will happen in the summer of this year. Madam Deputy Speaker, coordination, managing a complex rare condition like this can be challenging and often means interacting with many different specialists and providers of health and social care. This can include travelling across the country to access highly specialist care from experts, and all of this can add up to significant emotional and physical burden and deepen existing inequalities. Coordination of care can minimise this burden on patients and their carers and ensure healthcare professionals are working together to provide the best possible care, and we've discussed that this evening. In the 2025 Action Plan, we introduced a new action to incentivise providers to run clinics for multi-system disorders, reducing the number of individual appointments and improving coordination of care for families. The NHS is also working to include the definition of coordination of care as defined in the Concord or Coordinated Care of Rare Diseases study in all new and revised service specification within the NHS for patients with rare diseases. And in closing, Madam Deputy Speaker, I recognise how hard it is when patients want access to these new treatments. I also recognise the distress and worry it causes, not only for the patients but for their families and friends, and I think honourable members have articulated that well on behalf of their constituents this evening. The Government is committed to ensuring that we do provide access to the most innovative medicines, but it has to be at a price that provides value for the NHS and is clinically safe and effective. That is why we're working hard with industry, NHS England, NICE and MHRA HI to happen. I know the Honourable Member will continue to work with the Government and providers to make that happen as well, and I thank him and you for the opportunity to respond on such an important issue to this debate this evening.
The question is that this House do now adjourn. As many as that opinion say aye. Aye. The ayes have it. The ayes have it. Order, order.